In our practice, when we look at a patient and we recognize that they have a narrow upper jaw, we want to identify whether that patient is narrow in their jaw or in their teeth. There is a difference between the two. When a patient has a narrow jaw, you would prefer to use an expander that will actually expand the maxillary jaw, which is made up of two parts, in half to create the width. Studies that were done at the University of Pennsylvania have identified that patients who have larger than a 7 millimeter discrepancy between the width of their upper jaw and their lower jaw will have a 75% chance likelihood of having middle-age periodontal disease. So if there is a skeletal discrepancy or narrowness due to the jaws, it is important to treat the jaw. Now, oftentimes we can also look at a patient and recognize that it is their teeth that are narrow. When the teeth are narrow, different types of expanders are used, and basically it's a tipping motion moving the teeth into a wider part. When we use dental expansion, we try to work a little more slowly and it takes more time. Some patients, in fact, will come into the office and have both narrow jaws and narrow teeth. And interestingly, on those patients, they actually will go through both types of expanders. We don't use one expander to try to do both jobs. In doing so, there's a way for us to identify which expander is appropriate for that patient. The way we do that is by taking a radiograph of the front of the head and physically measuring the width of the jaws in comparison to the width of the head, and then physically measuring the width of the teeth in comparison to the width of the jaws. We have standard values for every age and sex, and those standard values will tell us which expanders are appropriate.